Hi and welcome to Delaware County Political News, Meet the Expert. We are here with Dr. Sam Flint to discuss cost, quality, and access to health care. Dr. Flint is a health policy analyst and advocate. Dr. Flint was with the American Academy of Pediatrics for nearly 20 years, and he has taught social policy and health economics at 3 universities. Dr. Flint has authored more than 20 articles on Medicaid and health reform in a half dozen peer-reviewed journals, and he has served as an expert witness in federal courts in multiple Medicaid cases addressing the rights of children to access medically needed care. Dr. Flint holds a BA from University of Rhode Island, an MSW from Florida State University, and a PhD from the University of Chicago. He and his wife, Rebecca, live in Media, PA. Dr. Flint, thank you for appearing today on my show.
Thank you for inviting me, Larry.
Dr. Flint, please highlight in your background what you've been doing in healthcare, which enables you to clear up what's going on in current events in healthcare.
Well, for 35 years I've been involved in healthcare. You mentioned the fact that I was Associate Director of the American Academy of Pediatrics and have published and been academic. I've also been an activist. As a matter of fact, precisely a week ago, I was arrested with 79 other people demonstrating against the new health bill in the Congress. So I was handcuffed for 8 hours last Monday. So the point is, I try to provide anything I can from my tool chest, whether it's academic work, letters to the editor, op-eds, etc., or being part of the indivisible movement and the so-called resistance to the Trump agenda with respect to healthcare.
And Doctor, I noticed that you've written a lot of articles. Can you highlight some of the most on point to cost, quality, and access to care?
Well, my principal training is as a health economist. So I have been writing, doing research on areas. I've done a lot of work in Medicaid. My doctoral dissertation at the University of Chicago in 1980 was on Medicaid and children and how continuity of care affects costs. So I've been involved with, again, policy, politics, and press, trying to provide data-based, evidence-based information. My role is to provide light rather than generate heat, with the exception of last week when I just kind of had to stand up and be counted.
So there is a need right now to get involved and fight the current political environment?
Well, what we're facing now is the biggest assault on access to care, financial access to care, that we've seen in a generation. The new Republican administration, the President, the Congress, the Senate being in Republican hands, they are basically trying to not just undo the so-called Obamacare, the ACA, as it's called, but they want to go back a full generation of expansions of the Medicaid program, the CHIP program for children's health insurance, and issues for Medicare. So this is not just a matter of going back 8 years, it's going back 38 years.
To understand what we're going on, can you give us some definitions to help this entire analysis? What is Medicaid, what is Medicare, and CHIP?
Sure, these programs are easily confused. Medicare and Medicaid were both enacted with Lyndon Johnson in 1965 simultaneously. Medicare was designed for older people, well, for seniors, people over 65 who paid the payroll tax, the FICA tax that you get for Social Security and Medicare. And it also is expanded very quickly for the disabled. So when you think of Medicare, think of people over 65 and people who are younger, who are disabled, who have paid in the sufficient amount of time to be eligible for the program. Medicaid, on the other hand, is for low-income people. Medicaid started to be the...
All right, let's say that again, because you actually said Medicaid. So when you think
It is
of...
Medicaid.
No. So
Oh.
when you think of Medicare, I just want to clear it down so people get it. So when you think of Medicare, go.
So when you think of Medicare, think about seniors, think about disabled people, and think about the middle class. This is a social insurance program. Everyone in the country gets Medicare and Social Security, okay? Medicaid, on the other hand, is a program that is designed for low-income people. Like I say, in 1965, it started out as health insurance for people who are on welfare. Then it delinked from that, so to speak, and it started including children who were low income, were not necessarily in a family on public assistance. It's expanded further and further. So it's basically low income families, low income children. The ACA, the Obamacare, included low income individuals and childless couples. So that's been the big group that had been excluded. And one other point that I can't underscore enough is that Medicaid is the principal payer for nursing home care in the United States. 64% of all nursing home payments or all nursing home beds are paid for by Medicaid services. Something like 38% of the total Medicaid budget is for nursing homes. So when you attack Medicaid, you attack the poor, you attack the near poor, and you're also harming people who live in nursing homes.
So to summarize, Doctor, because this is an important point for us to build on when we talk about this entire analysis. Back in '65, you said Lyndon Johnson started both these programs together, Medicare and Medicaid. And Medicare is for older people over 65 and disabled people, and it covers their health care moving at that age. And Medicaid is for low-income people who didn't pay into that in certain fund.
No, actually, they could have paid in, and there are dual eligibles. People who are eligible for both Medicare and Medicaid. It's complicated.
Sure.
And then there's one other group, which you mentioned earlier, CHIP, the Child Health Insurance Program. That was enacted in 1997, and that is for low-income children throughout the 50 states.
And that's good health insurance that covers children
It's
and their
good,
health
yes,
care needs.
it's good coverage. Basically it's a layer on top of Medicaid for children under the age of 18.
So Medicare are seniors, Medicaid, low-income health care, and CHIP, children.
Correct, low-income children.
And these started in 1965 by Lyndon Johnson.
Well, yeah, but the programs changed. Oh, that's the thing. He created a structure similar to Obamacare. Obamacare was criticized. It's not universal. But Obamacare has a structure that will allow for additional increments of people becoming eligible. So it could ultimately become universal health insurance. Same thing with Medicare and Medicaid. Medicare didn't have the disabled. That was added in '72. Medicaid, like I say, added children, added higher, less poor people. So the program continues. The end-stage renal disease program was an add-on to Medicare. Uninsured women that have breast cancer and cervical cancer are added on if they're uninsured and low income. They're part of Medicaid. So it's a vast program. It's not a there are at one point there were 64 different eligibility categories for Medicaid, and I think that's now expanded. One other point to distinguish the two programs too. Medicaid is funded by a combination of federal and state dollars, and it's administered by the states. Medicare is national, so if you live in Pennsylvania or you live in Utah, you have the same benefits if you're on Medicare. On Medicaid, you can be in one state and have much better benefits, much higher income levels for eligibility than you can in another state. So the Medicaid program is 51 different programs, the 50 states in DC. Medicare is one.
So Medicaid benefits vary from state to state based upon the wealth of the state and the need.
Well, that's right. The so-called federal share of Medicaid, every state gets at least 50% of its Medicaid expenses covered by the feds. It can get as high as 82% in very low income states. I think now the highest is about 79%. So it's somewhere figure between 50 to 80% is paid for by the feds. The rest is paid for by state government.
And you mentioned that throughout history, since 1965, there were various add-ons really to both programs, but one thing that you want people to understand is Obamacare expanded Medicaid, correct?
Obamacare expanded Medicaid, and it did so at state option. The original bill, it was anticipated that every state would take Medicaid, even though it was within their rights to choose whether they wanted to or not. The reason for that is the structure, the finances was so dramatic. I told you about 50 to 80% of funds get paid by the feds under Medicaid. Well, these new eligibles, for the first 3 years, it's 100% federally paid. Then it drops down to 97, 96, and at the end of 10 years, it's 90%. So for each federal dollar, for each state dollar, rather, you get 9 federal dollars or more. The average amount for the first 10 years of Medicaid, the state would pay only 4%. So 96% of the first 10 years were covered, with federal funds, but still states didn't want it. They wanted to maintain sovereignty. They wanted to set their own program, and candidly, they felt that these single adults should be working. If they're not disabled, then they should be working and earning their own health insurance in the marketplace. So they resisted it on philosophical grounds.
Now, you're painting a wide brush. You're saying the states. Is this all the states, or is this a segment?
Well, one more piece of history. The Obamacare bill was challenged by 26 attorneys generals in the state, went to the Supreme Court in June 2012, and at that time they approved, they said the law was legal, the individual mandate, the employer mandate, all the elements of it were legal, but under Medicaid they said it would be at state option as to expand. Surprisingly, 25 states, all of which had Republican legislatures and governors, 25 states refused Medicaid, the Medicaid expansion. Even though it was free for the first 3 years, and like I say, covered 96% of the cost was covered for 10 years. The Obama administration said, okay, let's make it easier. Let's not even tie. The original law said you had to cut, if you expanded Medicaid, you had to have it for 10 years. What the Obama administration said, okay, we'll do this. We'll just give you the first 3 years free. And you don't even have to guarantee years 4 through 10. And we're still going to give you that money. That enticed a few states. There were changes in elections, such as in Pennsylvania,
Governor Wolf,
under Governor Wolf, under the Democrats, and under some Republicans. John Kasich, governor of Ohio, said he wanted that money. So that was a state that ended up taking Medicaid. In Louisiana, Bobby Jindal, Republican, was firmly opposed. A Democratic governor got elected, and now they've taken it. So now we have 19 states instead of 25 that are still refusing essentially free care for their low-income people.
And so this is something guaranteed by the government that they refused. Is there an explanation for why these states don't want something that is basically free, a gift? Because the government uses money to control states by withholding money when they don't do something they want. But here, the opposite is happening. The states are saying, look, we don't want your free money. Is there an explanation for this?
Yeah. Why would states not take yes for an answer? Why would they not take free care? They did it for a variety of reasons, but they're all political. Because clearly, the benefits to the state for Medicaid expansion, healthier workforce, more money for the safety net hospitals and the other safety net providers that serve the poor. The only reason was political. Now, if you remember a few years ago, the Tea Party, the far right was very active, and they were challenging moderate Republicans in primaries. So the Republicans, the moderate Republicans at that time, were scared off, were afraid not to be far right. So they had to demonstrate that they were as conservative as the Tea Party members. You don't have to go to the extreme right. Right here in the conventional Republican Party, we'll do the same things that they want. So that, you know, they basically turned it down for political purposes. There was a famous quote in South Carolina by an ER physician who said, right now the politics say you should be opposed to the black man who's in the White House right now. So clearly it was done for political purposes, but it was so cynical because it really took away care that was needed, took away funding that was needed for the delivery system that cares for the poor.
Dr. Flint, is this a manifestation of the Speaker of the House back in 2008 trying to say we're going to do everything we can to make Obama a one-term president?
I'm going to correct you. It was Mitch McConnell who was the senator. But you got the essence of it. He says, my job is to make Barack Obama a one-term president. He said that with pride publicly multiple times. So this was clearly an obstructionist agenda. The Republicans have a different philosophy. They believe in smaller government. They don't believe health care is a right. They believe that health care is something that should be purchased in the marketplace, and you should earn your money for health care like you earn your money for food and shelter and other things that are needed.
But this refusal of free money, would this be that type of policy
Yes.
in action? How are people insured in the United States statistically?
Okay, here's a table that shows the major health insurers in the country. And it has the United States and it has Pennsylvania as well. And it's done by percentages. Each percent is like 3 million for the country, 700,000 for Pennsylvania. So if we take a look at, let's say, Medicaid, which in 2015, the most recent year that we have complete data, Medicaid covered 20% of the population, which would be about 60 million people in the U.S. In Pennsylvania, there's a little less dependence on Medicaid. It's 18%, so that would be 18 times 700,000, whatever that number comes out to. But the point is, number one, far left column, you see the employer coverage. Basically, half of the country is covered through their employer. We have an employer-sponsored system. And that's one of the things about Obamacare. It was criticized by liberals, by progressives, saying, why aren't you going for a single payer? And the reason for it was Obama wanted to have a system that would be the least disruptive to current arrangements, and he wanted to build on the systems that were out there. So employer coverage was half the country, a little bit more, 49% US, 55% PA. And then if you could take a look at both Medicare and Medicaid, you see that the numbers add up to 34%, 14% Medicare, 20% Medicaid at the federal level, and 16, 18 respectively in Pennsylvania. So a third of the government, a third of the population of the country is covered by government plans. This Medicaid figure also includes the CHIP program, which is a fairly small program relative to the others. Then you have the individual market. You can see 7% are insured in the individual market in the U.S. And 5% in Pennsylvania. These are the folks that go to the health insurance exchanges. They don't have the group plans of the employer, so they're not eligible for the public programs, Medicare, Medicaid, and CHIP. So they have to go in. And this market has always been the problem. Because you don't have a group to share risk, the variability in like a small group plan, 5 employees, or a family, there can be dramatic shifts. So insurers have to make sure they have proper reserves. So they charge, and you can argue overcharge to make sure they don't have to pay anything for the individual market. These are the folks who go to the health insurance exchanges. Not covered by employers, because the employer mandate under Obamacare is you have to work in a firm with 50 or more employees, okay? Now, the uninsured, you see here, is 9% in the country nationally and 6% in Pennsylvania. We're doing a pretty good job in Pennsylvania, in part because of that employer piece, because a lot more people come by employers. There's been a tradition in the Northeast in general, the region, to have union coverage, etc.
How did Obamacare change the statistics?
Okay, here's another table, which is just the United States. And again, each percentage is about 3 million people. So you can see in 2010, which was the year Obamacare was enacted, but it didn't commence until 2014. So but when Obamacare was passed, but before it started, we had 50% employer. Now it's 49%. That's basically the same number. The 5-year change is 1%. Medicare has increased a bit, 12% to 14%, and again, this could be 12.3 and 13.7. It's not necessarily a full 2%, but that's because we have an aging population. 10,000 people turn 65 every day. So the Medicare population is increasing, so that's what drove enrollment there. Under Medicaid, we see a big jump from 16% of the population to 20% of the population. Again, that 4% change is about 12 million people. That was because the ACA had two basic ways in which they expanded coverage. One, by expanding Medicaid, and the other by requiring individuals to have coverage either through an employer or through their own plan. So if you take a look further, you see the individual, people are insured individually. It was only 5% of the country before Obamacare. Now it's 7%. That 2% increase is about 6-7 million people, but it's a big increase for this particularly erratic subsection of the health insurance market. And then we get to the final column. There were about 49 million people, 16% of the country was uninsured in 2010. Now that's down to about 27 million. 7% of the country got health insurance coverage. And just this 5 years, and actually the numbers in 16 and 17 are even more strongly showing fewer uninsured. So again, that's 7% of the population. That nearly cut the uninsured rate in half. That's over 20 million people.
Doctor, you've given us how the statistics were improved by Obamacare. How did Obamacare do it?
Okay. This graphic that I'd like to put up now shows the different elements of Obamacare. As you can see, the first thing is it required an employer mandate, and there would be penalties for that. So the employer mandate, that's fifth down from the bottom, you can see 54% of Americans thought it was a pretty good idea, a little over half. It's interesting, by the way, the employer mandate as a notion was first started by Richard Nixon and not proposed by Richard Nixon in 1971. So the ACA is basically taking all the progressive elements within the Republican plans of the past and bringing it forward. It originally started out.
Was that strategic?
Well, it was very strategic because, again, politics is the art of the possible. Okay, Obama saw a window of opportunity which was not that big, and in knowing how many times historically universal coverage has failed, he took the most palatable pieces of the Republican plan and then slapped a Democratic label on it and said it's our plan. The Republicans loved it when it was the Republican plan. Once the Democratic label came out, it became a government takeover of the healthcare system.
Unfortunate.
So we understand how politics works.
Of course we do.
But the point is, so Obamacare has an employer mandate. 50 or more employees, you got to give them health insurance. Small employers were allowed to get, some kind of a subsidy for that. Obamacare said if you'll change Medicaid from if you're low income.
Hold that thought. I don't know that people understand this because they said a job killer, job killer, job killer. Tell us about that subsidy.
Well, the argument here, the question is, who's a full-time employee? So the arbitrary decision was made: if you work 30 hours or more, you're considered full-time, and you have to get full-time with respect to employers requiring you to get coverage. So the argument has been made that it's going to kill jobs, it's going to reduce hours. I remember one time there was a Republican phrase, we're going to bring back the 40-hour work week. Well, it's under the assumption that employers would be driven solely by trying to save money on their insurance rather than other things that motivate employers, keeping their good employees, paying them well so they'll be motivated. If you look at the unemployment statistics, it's continued to drop. We've had, 80 months in a row of private sector employment growth, which has continued in the Trump administration. So there is absolutely zero evidence that it's had a negative effect on employment.
And you don't hear them saying it anymore. You don't hear the argument anymore. Nearly as much.
Well, no. I agree. The argument shifts as the evidence is laid bare to more. So the first thing is make the employer a health system more robust. Employers have to cover everybody. And individuals, the individual mandate, every person has to have insurance, whether it's a government plan, Medicare and Medicaid CHIP, whether it's an employer plan, or if they're not eligible through an employer or through Medicare and Medicaid, that's when they go to the so-called health exchanges. And that's where you get the argument all the time that the exchanges are collapsing, et cetera. That's where they were to get their care. Low-income people are either exempt from the fine for not having health insurance or were given subsidies to pay insurance. So the idea was everybody is covered in the plan, and everyone has a basic, not basic, but the phrase is essential benefits. Included in essential benefits is is preventive care, first dollar coverage of preventive care. So what's that? That's measles and mumps shots for children. It's adult immunizations. It's cancer screenings. It's all of the kinds of preventive care that either is not covered by insurance or is covered poorly. This plan, no matter how big your deductible is, and a lot of the plans have been criticized because they are high deductible plans to make them as inexpensive enough so they can be afforded. But even the plans with high deductibles have first dollar coverage of preventive care. So that's the structure. Everybody's covered, employer, government, or through the exchanges purchasing health insurance. And they had to be covered. Everybody had to contribute to the pool. So that's the basic structure of it.
Who was Obamacare, the ACA, supposed to help?
Okay, it's interesting that if you take a look at this graphic from showing the country, the darker the area, the higher the rates of unemployment. So if you look in Minnesota, Wisconsin, Illinois, the Northeast from Maine right through Pennsylvania, California, you see those are lighter shades. Most of those people had coverage. The people in the dark areas, especially the very darkest areas, are locations where the rate of uninsured was over 30% of the population. So these are the people that were supposed to be helped. Ironically, if you take a look at this next red and blue chart of the country, the red shows the counties that voted for Donald Trump, and the blue shows the counties that voted for Hillary Clinton. The red areas in the center of the country, the central part in the south, that were the largest beneficiaries of Obamacare, are the ones who voted for Trump and for the Republican Congress to repeal Obamacare. They voted against their own self-interest. 91% of the people that are below the poverty line, that still are uninsured, that would be covered by this plan, live in states that were taken by Donald Trump. So there is a misinformation campaign that was quite successful.
Now, that's not evidence that Obamacare isn't working to you, Doctor. That's what the Republicans are going to say in response.
Well, no, it's not evidence at all. Again, going just to, I think we mentioned this earlier, that 19 states didn't take Medicaid, so those states remained with the high rates of uninsurance. So the fact of the matter is, it could have been more effective in terms of insurance.
If those
the insurance
states
coverage,
took
if the states took
Medicaid.
the essentially free Medicaid, and remember, not Medicaid, gives you money, brings money into the state. So yes, it helps the hospitals. Yes, it helps federally qualified health centers. But that means jobs. It means nurses. It means lab technicians. It means janitors, food service people. They're paying income taxes. They're paying sales taxes. They're not collecting unemployment. The money for Obamacare is an economic stimulus to the states. That's why the Republican governors are the ones, when the history is told of why it failed 3 times in the House and the Senate, it will be the Republican governors who put the brakes on it because they did not want to lose that kind of revenue to the state. So we have. So Medicaid beneficiaries are not just the people who have a Medicaid card and can go to a doctor in the hospital. It's those very same institutions and the broader community.